and today I'll be demonstrating how to do a sterile dressing change. For this video, you'll need a modular with a skin and band-aid intact. You'll need some clean gloves, a sterile dressing kit, and some hand sanitizer. For this video, my sterile dressing kit has been opened, but for now, we're just going to think of it as a closed and sealed sterile kit. After my supplies have been gathered, I will enter my patient's room. I'll close the door and pull the curtains to ensure patient privacy. I'll introduce myself to the patient. Hello, my name is Pranita and I will be your nurse today. May you please verify your name and date of birth? After the patient has identified her identity, which is Mrs. Smith, date of birth 2/15/1971, I will further ask her if she has any allergies to any medications or any products. After that has been completed, I will let Mrs. Smith know what procedure we're performing today. Hi, Mrs. Smith. Today I will be doing a dressing change on the wound that you have today. It will take approximately 5 minutes to do. If you have any questions or concerns, please let me know anytime during the procedure. Once that has been done, I will perform hand hygiene. Hand hygiene is always important because we do not want any germs to be exposed to Mrs. Smith's wound. Then I will apply my clean gloves on. Once my gloves have been applied, I will further assess where the bandage is placed. When I pull the bandage out, I will pull it in a parallel direction to the wound. I will dispose of the band-aid in the trash. Once the band-aid has been disposed of, I will further assess the wound. We're looking for any discoloration, any drainage, or any odor. Anything that's out of the normal must be reported. After the skin assessment, wound assessment has been completed, I will take off my gloves. And dispose of it in the trash. Then I'll perform hand hygiene again. After hand hygiene, I will open up my sterile kit. When I open up my sterile kit, I will ensure that I am not touching anything inside because I do not want to break sterility. After I opened up my kit, I will get my sterile gloves and carefully open up my sterile gloves. The sterile glove packaging does let us know which hand to don on. This will be my left hand, this will be my right hand. It is important to note whenever we are putting sterile gloves on, we should not have any nail polish on, no rings, and no jewelry of any sort, watches, all that. And if you're wearing long sleeves, they need to be up to your elbows. Alrighty, now that our sterile glove packet has been opened, I will use my 1-inch borders to carefully lift up the packaging. I need to ensure that I'm not touching anything inside besides my 1-inch border. Otherwise, we'll break sterility with the glove. Once my gloves have been exposed, I will don my dominant hand using my non-dominant hand. Doing so, I will grab the right hand glove by the cuff to help pick it up. And once that is there, I will don with my dominant hand. I will guide my fingers into the glove and use the cuff to help apply my sterile glove on. And again, we need to make sure that we do not use the cuff when donning our gloves on. Once the glove has been donned, I will scoop up with my dominant hand in the cuff to help pick up and guide my fingers into my left hand. I'll use the cuff to help guide the glove on, ensuring that I don't use the cuff. And again, when we're applying sterile gloves, we need to be away from the surface, that way we don't touch anything. Once my glove has been donned on, we will then use the applicator, but before we begin using anything in the sterile dressing kit, I want to first say that this will be my clean hand. This will be the hand that will be going and touching everything in the sterile kit, and this will be my dirty hand, which I'll use to help clean the wound. So now that we'll begin, we'll use our applicator. I'll pick it up with my clean hand and drop it into my dirty hand, and we'll begin to clean the wound inside out in a circular motion. Once that has been done, I can dispose of this into the trash, and then we'll begin to dry the wound with our drying gauze, which I'll pick up with my clean hand. I picked it up and I'm going to drop it into my dirty hand, and we will begin to dry the wound. Again, we're going to dab inside out in a circular motion. Once that has been completed, I can dispose of this into the trash, and we can use both hands to apply the Tegaderm. I will apply the dressing by peeling it. I'm keeping this here. And we can apply the dressing over the wound. And for video purposes, just in case if I have to do a remediation, I will keep the lining off. But in general, you're supposed to peel it off. After that, I will put a date and time just to let future providers or the oncoming shift know when the last dressing change was completed. Then I will put the patient in a comfortable position with the e-call in reach, and I will remove all my trash, put it aside, and take off my gloves. Perform hand hygiene and thank the patient for their time. I will ensure patient privacy by closing the curtain and the door, and then I will document any findings that I found on the wound, as well as document my procedure. Thank you so much.